South Korea caught corona just as Italy went down with it. Both suffered explosive outbreaks, but as infections and fatalities soared in Italy, South Korea suddenly began to turn the tide.
So I think we should be in very heightened alert and ready.
Professor Hun Sang-lee advises the government.
The government was able to make a very fast move to identify and isolate patients.
Early mass testing, he says, the secret weapon.
South Korea was able to provide this wide spread testing. In the earlier phase of the outbreak, testing is much more important. But later, maybe you just have to go into the mitigation measure.
South Korea had test kits in stock. When the virus hit, the response was immediate. Watch how COVID-19 spread in South Korea and Italy. By early March, South Korea had far more infections. Then look what happened. Today, Italy has 8 times as many infections. Deaths there stand at 7,500. South Korea's at 126.
One of the learned lessons that we can see from Korea is having the test available.
If test kits aren't widely available fast, precious time's lost. South Korea did not go into total lockdown. Its manufacturers went into overdrive, producing test kits straight away. Per capita testing is the highest in the world and mortality the lowest. Why? Because early detection minimizes spread and asymptomatic cases are caught. There's drive-through testing and booth testing, 600 centers nationwide, keeping people out of hospitals. Tests take minutes, results by SMS in hours.
Inside each booth, there's a UV lamp and negative pressure. It's disinfected and ventilated after each patient.
Diagnostic capability on this scale is South Korea's silver bullet, enabling forensic digital contact tracing. But aggressive tracing's intrusive. Laws enacted after the last respiratory epidemic, MERS, 6 years ago, enable the government to track an infected individual's digital footprints, mapping networks of transmission and closing them down.
I think it is a balancing act. Korean response was quite draconian if you compare it to the standards that you might think in UK. So, but it was not as drastic as what they have done in China. So I think you have to really see the balance between how we can sacrifice in terms of privacy, but also how we can really work for the common good of the public.
In Asia, there is just more acceptance of intrusive measures which in the liberal West might be deemed too stringent to stomach. It's a cultural thing, but in South Korea, it's also enshrined in law. Public health trumps privacy, which you surrender in return for greater protection from a killer virus. And this is a trade-off which most people support. Personal data harvested from debit cards and mobile phones being crunched by government apps which enable better, more detailed contact tracing, the creation of travel histories, and even alert users if they get too close to where an infected person's been. After SARS, then MERS, South Korea had a plan in place, as did Taiwan, Singapore and Hong Kong, which have also kept infection and fatality rates low. Unlike China's authoritarian response, these Asian democracies were transparent, and their citizens readily adopted corona courtesies and took limitations on liberty in a wartime-like spirit of national resolve. Approval ratings for President Moon Jae-in hit new highs. On Tuesday, Donald Trump called and asked for help, requesting the urgent provision of South Korean-made test kits. There's no number 10 on the call log.